2026 is going to bring about the highest health insurance premiums in history. And the reason is actually twofold. First of all, enhanced premium tax credits for ACA marketplace plans are going to expire. So people for the last 4 years who have been receiving a tax credit with income above 400% are now going to lose that tax credit, and now they're going to see the full price of their ACA premium. In response to this, however, all of the health insurance companies who offered ACA plans, thinking that they were going to get lower enrollment numbers with the higher pricing to the consumer, they all filed for huge rate increases on their plans already. So if I were someone who was receiving a tax credit with over 400% of the federal poverty line as an income, not only am I going to lose the tax credit that made my premium lower, but now that baseline premium is going to also get higher. So some people are seeing 2, 3, even 4 times higher premiums than what they're used to. And that all makes sense, that all tracks, and a lot of people understand that. But the number one reason why health insurance premiums are at an all-time high when we're talking about the Affordable Care Act is something no one is talking about. And that is the word risk. The ACA, the legislation that dictates what the federally facilitated marketplace health insurance plans are, forgot the most important concept in insurance, and that's risk. If you can't calculate the risk as an insurance company, you cannot control your costs. Think about it this way. If an auto insurance company could not calculate the risk to insure people, they simply had to give everyone the same premium based on their age and their zip code, how would they appropriately control their costs? When an insurance company wants to offer an insurance product like auto insurance, there are 3 factors in the equation. First off, what do you want to be covered for? In the case of auto insurance, do you want comprehensive? Do you want collision? Do you want uninsured motorist? Do you want medical reimbursement? Do you want windshield replacement? What are we covering your car for? The second pillar is, how much money are we covering this for? Do you want just state minimum coverages? Do you want the maximum limits of coverage? How much is the insurance company on the hook? And then they need to determine, what's the likelihood of a claim? What's your driving history? Where do you park your car at night? How many miles do you drive? How much is your car worth? These are all factors that auto insurance needs to take into account before they issue your premium. They don't just issue everyone the same premium based on their age and their zip code. That wouldn't work for auto insurance, so why are we thinking it's going to work for health insurance? It doesn't make any sense. The ACA has stripped away these health insurance companies' ability to assess the risk. So all that was ever going to happen with the ACA was premiums were going to rise, deductibles were going to rise, and the networks of where you can take the plan for your care were going to get tighter and tighter and more restricted. Because when we talk about the ACA, there's no way the insurance company can assess the risk. Can they determine what you want to be covered for? No. The ACA said, we're going to cover you for the 10 essential benefits, and every single ACA plan has to cover all 10 of them. Well, I don't know about you, but I don't need maternity coverage. I don't need drug and alcohol abuse and rehab. I don't even need pharmaceuticals covered. But every single ACA plan covers all 3 of those things. So now these plans cover everything. Second up, how much do you want to be covered for? The ACA doesn't put a cap on what they'll pay out. Once you hit your out-of-pocket max, that health insurance company is on the hook for an unlimited amount of money for the rest of the year. They can't control their costs on that. And number 3, this is the big one, the likelihood of you filing a claim. Health insurance companies used to be able to assess the risk of insuring someone by looking at their medical records. Now, I'm not saying there shouldn't be an option out there for people with pre-existing conditions. I absolutely believe in that, and I love that there is one. But not everybody should be subjected to that. Health insurance companies, if they can't assess the risk of you filing a claim when you are on their health insurance, and they can't limit their costs per claim, and they can't dictate what actually is going to be covered, they can't assess any of the risk, the premiums are going to go up, the deductibles are going to go up, and the amount of doctors who accept these plans is going to go down because the insurance company can't afford to pay all of them. That's what's happening with the ACA. That's what was always going to happen. And unfortunately, it's going to start going into a death spiral now. And what I'm meaning by that is the premiums are going to get so high that the only people who will end up being on the Affordable Care Act are going to be those who get a tax credit and those who have severe pre-existing conditions that cannot be accepted for insurance anywhere else. And as a risk pool in health insurance gets smaller and sicker, the premiums will only go higher, the deductibles will only go higher, and the places that you can go and seek care will only get fewer and fewer. It's going to enter a death spiral. Fortunately, there are plans on the free market that are already addressing this situation. These are plans that actually take the risk into account. They want to know what you want to be covered for. They want to know how much you want to be covered for, and they want to know what your health is. These companies that can then control their premiums, they can have lower deductibles, and guess what? They have networks where you can go wherever you want to go. And this is how health insurance had worked for decades before the Affordable Care Act came in. Those products still exist. So if you are healthy, if you are frustrated and sick and tired of how expensive health insurance is, and you are no longer receiving a tax credit, you don't need to be on the Affordable Care Act any longer, and you shouldn't be, because these premiums are just going to keep going up. And I, as a health insurance broker, the only people I'm advising to even be on the ACA anymore are those who otherwise can't medically qualify for a different type of health insurance, or those who are getting a tax credit, and that's it. I am seeing a mass exodus of people from the ACA to these private health insurance plans because they can keep them forever. It's a lower cost, it's a lower deductible, and it's a better network. So if this describes you, if you found this helpful, please follow the channel. Please learn more about health insurance. And if you need help optimizing your personal coverage, feel free to reach out.